we have the pain mechanisms, and there are three pain mechanisms described in the literature. The first one is nociceptive pain mechanism, and I believe almost all clinicians are aware of this. It's probably likely the primary driver of its MDT syndromes and other classifications, and it's pain caused from actual damage or threat to our body that activates the nociceptors. Then we have a neuropathic mechanism in which we have a lesion or a disease of the somatosensory nervous system, which actually affects the neural tissue. And in this category, patients typically experience distinct set of symptoms such as burning or electrical sensations or pain that is caused from non-painful stimuli, allodynia. It's associated with increased drug prescriptions, many visits to health care professionals. The symptoms tend to persist and become chronic. And we also can have sleep disturbances, anxiety, and depression. They tend to be more severe, let's say. And then we have the quite recently introduced mechanism, which is nociplastic pain. And when we talk about nociplastic pain, we're actually talking about altered nociception, with sensitization being probably the major underlying mechanism. And there we do not have any actual damage, or there is no threat, and there is no lesion or disease to the neuropathic system, but the nociceptors are activated. And this is probably the mechanism that we are dealing in most of the persistent or chronic pain situation. And it actually can mimic very well nociceptive pain. So it's very important to understand firstly the pain mechanism, because this will actually define a lot your prognosis. So from your MDT assessment, you have symptoms quality, onset, how did they begin, time phase. You do have other components from your assessment, from your physical examination, and you can actually use questionnaires like DN4 or Pain Detect in order to differentiate between nociceptive and neuropathic pain, and you have central sensitization inventory to assess the existence of nociplastic mechanism. It's very important to understand that even those mechanisms can interact, and you can have a mixed pain condition. It's quite common, actually.